Hi, Phoenix. I'm so excited to talk to you today. Obviously, we go way back and have worked together for many years with many families and many different types of settings, but excited to be here with you at Prospect Hill today. And one of the many things that I've loved about what you do, what you've always brought, what you're passionate about, just an area that I've always admired about you is how you work with family systems. And over the 15 years we've known one another, I know you've gone back to school many times. You're one of those chronic overachievers. I love that about you. But if I recall correctly, in your last doctorate study, it was specific to family systems and family involvement in treatment. Would you mind sharing a little bit about that and the results and the outcomes, and also what led you to be interested in that, why you chose that out of everything you could have done your dissertation on? Tell me more.
Yeah, thank you, Kelly. And that's a really good question. And family systems is absolutely what I'm most passionate about. And I think I developed that passion early on in my career working with people that were in treatment for mental health and also for substance use disorders, when I noticed that in their clinical presentations, there was so much discord in their family systems. And when I would interview the clients, interview the patients, and they would tell me really about generations and generations back of untreated mental health, of untreated substance use disorder, and none of those people in the family were getting help until the identified patient showed up for treatment. So the opportunity became, how do we involve those people in treatment, not just for the sake of getting the individual that's there in treatment well, but how do we get the whole family system well? Because we can't expect one person to go to treatment and get well and then return to a family that's been untreated where nothing has changed and expect that they won't go back to doing everything exactly the way that they did before. Mm-hmm. So I was inspired to do my research study and looking at how does family involvement in treatment not only impact the individual that's presenting for treatment, but how does it impact the family members themselves? So when I looked at it, I decided to look at what are the most common presentations for family members that have a loved one that has presented for treatment. We see depression, we see anxiety, we see levels of stress. So I did a study where I had family members participate in the research study when they had somebody in treatment and did pre and post tests looking at their depression, anxiety, and stress prior to the treatment stay upon entry upon admission, and then afterwards and well afterwards. Mm-hmm. And by and large, what was determined that just through their participation in the treatment for the loved one that was presenting for care, that their depression, anxiety, and stress all had statistically significant decreases. So it was evidence that when we involve family members in treatment, it suggests that it's good for them and for the patient. And you can treat the whole system and then set the stage for when the patient returns to treatment, their family is well and able to accommodate the changes that they made in treatment as well.
And so really leaning into and addressing the generational trauma that we see, right? That Absolutely. In many of the family systems we've worked with, when we do their family history, it is not just parents, grandparents, it's great-grandparents, it's great aunts, uncles, on and on and on. And you see the trauma repeat itself, whether through substance use disorders, mental health conditions. And so when you speak about involving the entire family system into the treatment episode, how often do you find that the families themselves are even aware of the generational trauma that they are continuing, but more importantly, how they, by doing their own work, have the opportunity to change their trajectory so that their grandkids, their great-grandkids don't have the same family dynamics that aren't healthy?
I would say many times they're aware and sometimes they're not. But what happens is parents, even siblings, tend to manage their own anxiety through the person that they perceive as sick. Mm-hmm. So they're very often not willing to look at their own wellness and how their untreated mental health or substance use disorder has trickled within the family systems. It often takes that person that is showing up in treatment to say, wait a minute, here's the things that have been happening in my family, and here's the things that have been happening over time, for us to really get a good view of what that's looked like. And usually it's the patient that is presenting for treatment that says, I want to break this cycle. Mm-hmm. And that's the opportunity for us to be able to treat that individual and not only treat their family members so that they can achieve wellness as well, but also to prevent that intergenerational trauma from being transmitted to yet another generation.
And that level of insight is so powerful, right? When you have that client sitting in front of you that says, I want to break this cycle, I just need help to do it.
Absolutely.
As the Chief Clinical Officer at Prospect Hill, how do you involve families into their loved ones' treatment?
So we do a thorough assessment with our patients, and we invite our patients to involve their family members. So when we start to see clinical issues arising, we know it's appropriate to start engaging the patients. We want to have our family therapists, whether that's myself or another therapist on the team, reach out to the family members, not only to gather information, but to understand their experience, to understand how they've been part of the genesis of what's occurring for the identified patient, but also get a family history of what's happened to them, their perceptions of the problem, but also how they've experienced too, and what their anxiety, depression, feelings, fears, concerns are. And then when we do a thorough assessment of that, we want to invite them in, not only through virtual sessions, but actually come in and participate and be part of the treatment experience so that we can treat the family system as a whole and do dynamic work with the patient and their loved one, whether that's spouse or sibling or parent. We can bring them in and actually do dynamic work with them in person.
Wonderful. In your experience, and I know we've both seen this happen, that oftentimes when what we call in the industry our identified patient, right, the client who's showing up for treatment, they oftentimes are hesitant, reluctant, flat out refuse to allow family members to be involved. And we know that's usually for a variety of reasons, right? Shame, guilt, anger, fear. But how do you help them see the importance of involving their family, why it's imperative, why it will allow them to show up differently in all areas of their life, all the goodness, the positives that come from allowing that loved one to be involved, even when there's been a lot of discord, there's been a lot of unhealthy dynamics. How do you lean into that?
So, I mean, there's a couple of different things. I mean, part of what you addressed is that a client coming into care, they could be at various different stages of, acceptance of what's actually happened for them, what's happening for them, what life is going to be like when they return. And sometimes the real fear is, if I involve my family in the process, then then everything really changes. So some patients will actually feel very threatened by their family involvement. They're also holding on to secrets. They're holding on to pain. They're both afraid to hurt their family members by sharing information, but they're also afraid of, if they see the truth, then what will their response be? So part of it is really about creating a safe platform and really building that relationship with the client to set the stage for that, but also helping them understand that if their treatment goal is to get well and they want us to help them reach that goal, then we have to eliminate whatever barriers there are to the achievement of that goal. And sometimes that barrier is their own fear. So it's working through that fear, helping get around that fear, and in the safety of the clinical relationship and knowing that there's very skilled and caring clinicians that are here to support them, not trying to hurt them by involving their family, but that piece of also explaining to them that this actually allows us to look at it as in a systematic perspective so that you don't actually have to bear all the blame. It's not about blaming any other individual as well, but what we are saying is that this is a systematic issue. And if everybody's been part of the genesis of this problem, then let everybody be part of that solution also.
I love that. Can you speak to family of choice? One of the things I've always been very impressed by is how you help clients who oftentimes, due to no fault of their own, just their life circumstances, the traditional family isn't willing or able to be part of treatment, but helping them find a family of choice and what that looks like and how they can foster healthy relationships and have healthy attachments with those that maybe they don't share genetics with.
Right, so that's a really important point because family can look different for everyone. And what we do know is that we all benefit from support. right? So even if our family is unwilling to participate, because sometimes that happens as well, sometimes we want our family to make changes and they're actually not willing to entertain those changes. So what happens if they don't? And where do we get that support? So it's not uncommon that we might invite somebody that has a business associate that is one of their best friends, that is that support, that neighbor, that person, that it could be somebody that they've known from the rooms, from the 12-step programs. It could be a childhood friend, but whoever is identified as family, sometimes it's even, a business matter. We've even had people come in that have said, the main confidant in my life is actually my attorney. How can my attorney be involved in this process? So we want to invite, however a family system is defined for that individual, invite that person in to get well and be part of the solution and be part of the process of getting well, not only for the patient, but for themselves as well. Because these people that are supporters have also been impacted and they often don't know what to do.
Right, absolutely. Can you speak a little to the importance of being able to set and enforce healthy boundaries and how boundaries are not designed to be punitive, but rather to protect ourselves and protect our loved ones?
Right, so that's a hard one, right? So especially when there's mental health concerns, when there's substance use disorder, very often relationships are very enmeshed and boundaries are all out the window. So boundaries are what keep us safe and keep us knowing where you start, where I end, where you begin, all of those things, right? So it's important, if we want to heal in relationships, it's important to establish what those boundaries are and those expectations. I recently was speaking to one of our patients, and she's afraid to go home and she's afraid to go into a family system where the boundaries are shifting and the family wants to raise expectations of her. And so she's resistant, feeling like she doesn't want to be controlled, she doesn't want to be told what to do, but at the same time, it's helping this patient understand that through the substance use disorder, through the mental health issues, that her family actually went through a trauma as well. There were lots of traumatic experiences for all of them. So establishing some boundaries and a structure and some rules to help keep everybody safe is very appropriate and can really support the wellness of the family system to be able to move forward. And one of the things that I always say, my 3 magic words are consistency over time.
Right.
This patient was saying, well, why can't they just trust me? Why can't I go home today and they just accept that I've been here for 45 days and I've done really well. I've done my time, I'm well, please accept me back. And it doesn't always work that way because there is a recognition that family members have also been impacted, and we don't want anything to feel punitive to anyone,
Right.
but we do want to have healthy boundaries that do promote healing in recognition of the fact that they might recognize that you did wonderful work while you're in treatment, but they also need to see that consistency over time to believe that the changes that you've made will become permanent changes that lead to your mental health and wellness, and that they can be part of that solution to support that as well.
It's the epitome of both things can be true, right?
Right.
You did do amazing work.
Right.
And consistency over time is what will allow your family to feel safe in trusting that your journey is going to continue going in that direction.
And it's also the recognition of the piece that even though we do family work and we can engage family in the process, they have to take their own journey as well. So
Right.
often they have their own therapists in their environment. So they're going on a different kind of journey, and they haven't necessarily benefited from 45 days of intensive treatment like the identified client or the identified patient.
Right.
So sometimes the families also need that time with our support and with the support of their therapist and their environment as well to catch up to that and meet the intensity of that work in a different way.
Absolutely. Well, thank you so much. It's always a pleasure, and
Thank
so
you, Kelli.
excited that Prospect Hill has you here to guide them and especially to support the families alongside of the clients.
Thank you so much.